Hello, and welcome to the 2021 OSF Healthcare Children's Hospital of Illinois Cystic Fibrosis Education Night. We are so happy you have all joined us, and we are excited for our informative evening. We are going to start off with information from Kelly Fleeman with the Cystic Fibrosis Foundation, Greater Illinois Chapter Peoria office. Then we will hear from Janet Glavin about Make-A-Wish Illinois updates. We will then hear from Dr. McLaughlin, our CF Center Director, about our Cystic Fibrosis Center. Finally, we will hear from Paula Lomas with the Cystic Fibrosis Foundation National Office about NACFC highlights. We will now start our evening with information about the Cystic Fibrosis Foundation. Here is Kelly Fleeman, the Associate Executive Director of the Greater Illinois Chapter Peoria office.
Again, my name is Kelly Fleeman, and I have been with the foundation for 18 years. It's a long time, I know, and it's been a great 18 years. And during that time, our chapter has held countless great strides, countless galas, volunteer events, etc. And we've actually raised millions of dollars right here in Central Illinois for the foundation. The foundation relies on those funds to fund its expansive role in the CF community. Everything ranging from fundraising to care center support and accreditation to research and development, the very important therapeutics development network and clinical trial network, patient support programs such as COMPASS and the CF Foundation Care Support for CF caregivers. All of those are programs that are funded by the fundraising that we do here and across the country for the local chapters. The foundation is also very busy advocating for policies that affect the CF community and policies that affect healthcare, funding for the NIH, and issues just important to the CF community as a whole. So the foundation, I just wanted to start with, just completed its annual NACFC, and that's our North American Cystic Fibrosis Conference. I will provide a couple of slides with some information. And one of those slides will have information on how to tune in to some of those plenary sessions on research and development. In addition, there were many other great topics presented at the conference. So some may be more of interest than others, and those will all be available for you to view in your own time. I look forward to working with the CF Care Center in 2022 to support the local CF community. And I'm going to provide my contact information on the upcoming slides as well. And I really do encourage anyone who has a question about the CF Foundation, would like to become involved in any of our programs, to please reach out to me. I am available 24/7.
Thank you, Kelly. Now we will hear about Make-A-Wish Illinois updates from Janet Glavin, who is the Senior Community Engagement Manager with Make-A-Wish Illinois.
Thank you very much. I'm really happy to be presenting this evening, and I wanted to share a few updates with you. So as you know, Make-A-Wish is focused on doing one thing, and that is creating life-changing wishes for children with critical illness. And for the CF community, we want to make sure that children are referred at a time when the wish can have maximum impact in terms of benefiting that child's health experience and also give them that boost that they need. And the journey of a wish starts long before the wish happens. It starts when our volunteers go and meet that child, your child, and start to discuss with them what they might be wishing for. So I wanted to talk a little bit about the impact of a wish, what wishes look like now in in the COVID time period, and who's eligible and how to refer or make sure a referral for your child is moving forward. So one thing, our mission and our vision is to make sure that we grant the wish of every eligible child, and to protect the health of during COVID is to make sure we protect the health of wish kids and their families, and that no child waits even one unnecessary day for the experience to bring hope and joy into their lives. And with that, the psychological and physical benefits of a wish, we have research that shows significant positive changes in reducing their length of stay, time of hospitalization, and compliance with treatment protocols. And so that's something that's really important for your family and for your child. We want to make sure to reinforce that's our goal with the wish. So during the period of COVID, wishes are definitely happening, and all through COVID have been happening, although we did have put a number of wishes on elective hold during COVID just because of the necessity in the early days. But we are moving forward with wishes, and we're doing a lot of locally delivered wishes, but also we are doing and have resumed domestic air travel, bus travel, and travel to mass gatherings. Really important for you and your family in considering when you're going to start the referral process for your child is that they do not need to know what they have chosen for their wish before they meet. I really want to emphasize that, because that journey process really is looking at capturing the heart of their wish that's going to have that maximum impact. And they may choose travel, or they may choose something very simple, but we really want to make sure we've captured the heart of the wish. So please don't feel that your child has to know what they're wishing for before we begin that creative process with them. And a couple of other things I want to make sure that you're really aware in the CF community. So we are granting domestic travel wishes involving air, train, or bus travel, and wishes involving large gatherings. And that's for families who are vaccinated. So while we won't be collecting copies of vaccination cards, we're asking families to sign a letter of understanding, attesting that all the wish participants, so all of the family members that are participating in that wish, are fully vaccinated before we begin travel planning. I want to really, really reiterate, Make-A-Wish is granting wishes currently for all eligible children. We do not require anyone to get vaccinated to receive a wish, but in regards to domestic travel wishes involving air, train, bus travel, or large gatherings such as theme parks or sporting events, we are asking for families to attest that they have been vaccinated, as is recommended by your medical provider as well, and the CDC and our Make-A-Wish Medical Advisory Board. So car travel, if the destination does not involve a large gathering, as well as a wide variety of other wishes, those continue to be granted, and they're really viable options for families who are not able to or choose not to be vaccinated with the COVID vaccine. So Make-A-Wish is currently still unable to accept international travel or cruise wish requests for this foreseeable future due to the availability and statistics on the rate of vaccination and transmission rates for COVID-19 currently. So we will continue to provide updates to your CF referral contact, which is Tricia Green. And just to conclude, I want to mention again the referral process. You yourself as a parent or family member can make the referral inquiry at illinois.wish.org/refer. That's on our website at illinois.wish.org. But your medical providers, they are making referrals. So Tricia is our point person on that. And that they make that on a closed, secure site for medical providers to begin that wish process. So with that, I thank you so much. We're always very excited to work with the CF community, and love this evening and presentation, and really hope that next year we can be in person to see and talk to you.
Thank you, Janet. We will now hear about our very own Cystic Fibrosis Center from Dr. McLaughlin, who is the OSF Healthcare Children's Hospital of Illinois CF Center Director.
Hi, everybody, and thanks, Tricia. I am thrilled to be here. My name is Heather McLaughlin, and I'm the Center Director here in Peoria. I'm a pediatric CF physician, and I was just going to give you a little information on our center, what we've been doing, and what we're excited about here over the past year or so. So you can see on the screen, this is our team. Most of these folks, for you, those of you who have been coming to our center for a while, know everyone. But in particular, we have some new folks around. Introducing Anna, the newest member of our team who just joined us this week, one of our new nurses. And we're really excited that we've got a great crew, as always, who are excited to help care for you in your CF journey. We are very, very lucky in the CF community to have our CF patient registry, which is a national database that collects information about folks with CF from around the country. About 30,000 people are in the registry, and we get really good information and data about patient outcomes that can help to guide care for everyone in our community. So each year, our center gets our yearly report that gives us information about how we're doing with various outcomes with cystic fibrosis. So this report shows us national averages for markers for health and disease severity in CF, and helps us to understand what we can do to help care for you better. So this year, our center had 54 pediatric patients and 53 adult patients on the 2020 CF Foundation patient registry. So a huge thank you to all of our patients and families who contribute that consent for us to collect their information, to provide this information nationally. It really has been incredibly impactful for the CF community to have that information. So thank you to all of you for your contributions to this. So I'm going to go through some things here. This is part of the approximately 200-page document that we receive every year from the CF Foundation. Our data is the red line on the screen, and the national average is the green line on the screen. So this, for example, this report is for body mass index in pediatric patients 2 to 19 years, which is one of the main outcomes that we look at in cystic fibrosis. So you can see that we have trended near the national average for body mass index. Our trend this year was a tiny bit down, but overall, we are remaining pretty steady for body mass index for pediatrics. For adults, I think this is really exciting information. Our red line and the green national average, body mass index in adults 20 and over has seen a steep increase for both our patients and nationally over the last year. And I think a lot of this, for those of you who are familiar with all of the CF information, you know that the biggest piece of information that we've gotten in the last year has been the addition of Trikafta as a modulator therapy for many of our patients in the fall, October, November of 2019. So, of 2020. This is really exciting information, and you can see that it's been very impactful for body mass index in our adult patients. So FEV1, which is a marker of lung function, which we measure in all patients who are able to do a pulmonary function test. This is for ages 6 to 11. Our 6-year-olds are really just learning this technique, and then our 11-year-olds have had a number of years to master it. We are a little bit underneath the national average, with our program being just under 90% for FEV1% predicted for our 6 to 12-year-olds. We're hopeful that with the approval of Trikafta for our 6 and above patients, for many of you and patients who have at least one delta F508 mutation, that we will see some positive trends for FEV1 in this age group for our next data cycle. So here are 3 to 17-year-olds, and you can see both us and nationally are trending in an awesome direction for FEV1 lung function for this age group. So these are our adults. Again, we are the red line and the national average is green. So again, you can see that FEV1, median FEV1% predicted for this age group has had a positive trend, which is awesome. So when you come to clinic, one of the things that we do, of course, is send a sputum culture 4 times a year. And methicillin-resistant Staph aureus is one of the pathogens that we're culturing for because it is shown to be an infectious pathogen that can have a negative impact on health and lung function. And so back in 2016, you can see that like little mountain there. We were a little bit concerned about our MRSA rates because we were higher than the national average and trending in a positive direction. Thankfully, that has leveled out. Interestingly enough, MRSA in Peoria tends to be higher than the national average in general, not just for folks with cystic fibrosis. MRSA can cause skin infections, et cetera, and our rate of community-acquired MRSA is higher than the national average too. So it's not surprising that our folks with cystic fibrosis also have culture positive MRSA higher than the national average, but thankfully our trend has leveled off. And again, you can see a somewhat similar trend for our adult fibrosis patients. So here is our Pseudomonas data. Again, an important pathogen in CF, as you all know. Overall, our Pseudomonas culture positive rate is trending in a negative direction, which is a good thing, as is the national average. It's similar trend for adults that you can see that at least over the past couple of years as well. So this is really interesting. And, you know, 2020 was an incredibly complicated year. Of course, the elephant in the room is COVID and the pandemic that has impacted all of us. But as far as hospitalizations for cystic fibrosis go, I think this is really interesting information. From 2019 to 2021, we saw a dramatic decrease in the number of pediatric hospitalizations for CF. And the reasons for this, of course, are probably very multifactorial, but the two that jump out to me, of course, are number one, everyone was staying home and weren't around other people with germs, and we were all socially distancing and wearing masks. But also, of course, Trikafta was approved for folks 12 and above immediately prior to when the pandemic began. And so I think it will take some time for us to see if this trend continues. But it's really exciting for us that overall, our pediatric patients are staying out of the hospital more than they were prior to the pandemic. And the trend, although not quite as dramatic for adults, certainly can be seen in our adult population as well. And so in 2019, we had over 50 adult hospitalizations, individual events for hospital admissions. And in 2020, it was just over 20. Now, we're already into about 3/4 of 2021, and I believe that this data is accurate up through the end of September. And so there will likely be a few added to our 2021 data, but we're really excited about this, and we're really hopeful that all of these trends continue, that folks are healthier and staying out of the hospital with many of the new therapies that are available for CF. So other things that our team has been doing, again, there have been a lot of changes that have taken place due to the COVID pandemic. And our quality improvement initiatives, which, as you all know, has been incredibly important to our team through the years. We've had a number of discrete projects that we've worked on, including improving our culture of research at our institution. We were a part of the partnering initiative through the CF Foundation, where our team received additional training on how to best support our families and how to communicate in ways that really partner for this complicated condition, cystic fibrosis. We were part of the lung transplant learning and leadership collaborative, and still are, and that is ongoing. And then we have somewhat recently, begun an additional QI project focusing on adherence to the CF Foundation care guidelines. So these have been the discrete projects that we've been working on. I would say that in truth, a lot of our quality improvement efforts over the past year have really been ad hoc and responding to the unique needs of the past year. So for example, telehealth was something that prior to 2020, we had never really done that before. And so that was a really complex process, getting that that process started, working with our hospital system, working with families to make sure that they had access to telehealth capacity. And then, of course, figuring out how do you care for CF over the phone or over a computer screen, getting spirometers into the hands of families so that they can use them for telehealth visits, making sure that we have ways to get sputum cultures when families aren't in front of us, figuring out ways to make sure that we're providing excellent care, standard-based care, and all of that in the environment that was rapidly changing. So these are our 4 QI projects, but in reality, it was minute by minute, week by week, kind of responding to the new and evolving needs of the environment that we're all in right now. So one final slide about research. We are really, really proud of the fact that throughout all of this, our research efforts have continued. As you know, we are a TDN center, so we are involved in the national research with folks through the CF Foundation. The trials that we were involved in were paused for a while to figure out the logistics of making things happen in person when we weren't seeing anyone in person there for a couple of months. But for the most part, we are back up and running. We are doing research, we are doing it safely, and we are actively seeking additional research projects for all of our families to be involved with if they would like to, with a focus on really trying to do the research studies that are the most impactful for everyone in our community. And so you'll hear about a lot more about that from the CF Foundation, but research is the heart of a lot of the efforts that go into finding new therapies and new things that can help our patients and families. And so we're really excited that we've been able to continue that. And it's thanks in large part to a lot of effort by a lot of people to make sure that it has happened. So thank you all very much for your attention. I am thrilled to, partner with all of you to make sure that you get the best care that you and your family members need. And it's really an honor to be a part of this great group of folks here, the team that is involved in your care. So thanks very much, Tricia, and I'm going to pass it back to you.
Thank you so much, Dr. McLaughlin. We are now ready to hear from Paula Lomas, who is the Senior Director of Clinical Communications at the Cystic Fibrosis Foundation National Office. In 1988, Paula started her CF career at a small pediatric care center on Long Island. She has worked at 4 CF programs in 3 states in pediatric and adult care and was a CF research coordinator. It has been her privilege to be part of the great strides taken by the CF community over the past 33 years. She has a passion for supporting CF care teams and was a quality improvement coach prior to starting her tenure at the Cystic Fibrosis Foundation in 2015. She and her team ensure that information and educational resources are shared with the Care Center Network to support their ability to provide high-quality, specialized CF care. Thank you so much, Paula, for joining us.
I am a friend of OSF, and I am thrilled to be here. I got to know this team when I was their quality improvement coach, and I was very happy to hear that they are continuing on that quality improvement journey. So tonight I was asked to speak to you about the highlights that we heard at the recent North American Cystic Fibrosis Conference. And the last time I was at your education night was back in 2018. I just wanted to share a nice photo. I wish we were there together in person. I know your team has changed a little bit over the past few years, but it is great that we continue to have a nice collaboration and friendship. So as we have a discussion about the North American Conference and what we learned that we needed to look back and to our past, learn from our past. It has helped to inform our present, and it will continue to help us as we look forward to a bright future. And when we talk about the past, of course, we talk about the patient registry. The registry, as what was mentioned, is truly a rich resource that we have at the CF Foundation and through our CF community. And we've had this for decades, and we are able to learn from the registry data. We want to test to see, are we getting the outcomes that we expect from the treatments that are prescribed? And the registry, as you heard, also helps your care team with their quality improvement efforts. And I would like to join Dr. McLaughlin in thanking you for consenting to allow your team to put either your child or your data into the patient registry. Well, as was mentioned, at the end of 2019, October 21st, 2019 to be exact, we were given a wonderful gift, a wonderful surprise, actually. The FDA approved Trikafta. Surprise because it was about a month earlier than we at the CF Foundation had anticipated. But it set us up for a great journey, and it helped us through that year, 2020. And what a year it was for all of us. Well, let's look at what we see in the history that we've had with CFTR modulators. In 2014, there was one modulator approved by the FDA. That was ivacaftor, also known as Kalydeco. And in 2014, less than 1,100 individuals were on a modulator. And over each year, more individuals were prescribed modulator therapy. Up until 2020, more than 20,000 individuals with CF were prescribed a modulator. That really is wonderful, and it shows how we worked together. Look how far we've come in just 6 short years. Now, I know it's not fast enough for some, and we still have a ways to go. And I want to tell you, if you don't have a modulator because your child or you have a nonsense mutation, or perhaps you don't tolerate the modulators that we have right now, we are not done yet. And I hope you learn that and hear that in my voice throughout this presentation. Well, what else did we learn in the registry from 2020? Well, we saw a rapid decline, quite a decline, in pulmonary exacerbations. And some of you might say, well, of course, that people had to have social distancing and they had to wear a mask. But no. Look back. We started to see this decline at the end of 2019. So that tells us that this started and was really because of Trikafta. Isn't that wonderful news? Another number that we see decreased in the CF patient registry are the number of individuals receiving lung transplants. Typically, we see around 200 individuals receive transplant. And last year, in 2020, we saw less than 100 individuals receiving a lung transplant. Now, this is what we have heard. Individuals who were on a transplant list were prescribed Trikafta, and their lung function improved enough that they were able to come off the transplant list. We at the CF Foundation are committed to learning more about lung transplants, about funding research around lung transplant, and we do not look at this and say we're going to be giving up on that. No, we are here for the long haul, but we are very happy to see this number decrease. Well, here's a number that increased, the number of pregnancies in women. Now, usually we see about 200 pregnancies in the registry, and in 2020, we saw more than 600 pregnancies. Putting it into context, in the United States, in the general population, the number of pregnancies went down. And we know that, and we had heard that there was a Trikafta baby boom, and there certainly is. And as a former adult clinician, this makes me really very, very happy. It says to me that those individuals who would like to meet that life milestone of being a parent, if they're a woman, then they can. And this is just great news for us. Another great number that we saw was the median predicted age of survival. When I started in CF back in 1988, the median predicted age of survival was not even 29. In 2020, that number was 50. Now, I am 60 years old, so I know that 50 is still young. And we anticipate this number to just continue to increase. And that is very, very, very exciting. Well, other changes we saw. Changes in healthcare delivery for your CF care team. Dr. McLaughlin mentioned this. Your team had to show their agility. They had to show their innovation. They had to work on their communication amongst one another as well as with you, their patients and families. And we have to take that information and what we learned to plan for future care delivery. What we saw was in 2019 and into early 2020, the vast majority of encounters or visits were in clinic, in person. Of course, and then March of 2020, everything shut down, rapid decline in in-person visits, rapid incline in non-clinic visits, so the telehealth visits or the telephone visits. And interestingly, by the end of 2020, in December, there were an equal number of in-person visits and telehealth visits. So this teaches us we need to take a look at that and learn from 2020 and how perhaps we can deliver telehealth more efficiently, more appropriately. We're going to be learning more as we continue. Well, future care will also look a little bit different. We will have some individuals who get to start a modulator at a young age, others who start a modulator in adulthood, and then of course those who are without a modulator at this time. We want to make sure that high quality care is available to all individuals with CF. And will there be some changes in the healthcare team, in your CF team? Will we need to bring in more specialists? We're going to be working on that, taking a look at how we can improve care in the future. Well, let's turn and look a little bit at the path to a cure. You know, that path to a cure is not a straight line. It's a winding road, and it brings unique obstacles. Shortly after TRIKAFTA was approved, the CF Foundation announced the path to the cure. And this has been an ambitious research agenda meant to deliver treatments for the underlying cause of this disease. And ultimately, we are looking for a cure so that every person with CF can benefit. This path presently has 3 strategies: repair the CFTR protein, and that would be through modulators; restore the CFTR protein, and that would maybe be through messenger RNA therapy; or perhaps we will want to fix the CFTR protein, and that would be through gene editing. So let's talk about repairing the CFTR protein. We talked about modulators. Well, we would like more modulators to be available for more people. In June of 2021, TRIKAFTA was approved for those ages 6 to 11, and the trials for those ages 2 to 5 are ongoing right now. And we are looking to expand TRIKAFTA for other mutations. In December of 2020, the FDA approved the expansion of TRIKAFTA for an additional 600 individuals with CF. And we continue to look at more mutations. And the good news is that we are learning that the more we look and that the more mutations we look into, the more mutations we identify are responding to TRIKAFTA. The CF Foundation Lab, located in Lexington, Massachusetts, has been sponsoring a study to look at 650 additional mutations. They have found that more than 2/3 of those mutations are responding to TRIKAFTA. They've shared this data with Vertex. It will be Vertex's responsibility to submit this information to the FDA. So let's take a look at who has been impacted by the expansion of TRIKAFTA. The graph on the left shows the percentage of people who were eligible for Trikafta when it was initially approved. And the graph on the right was after the expansion. And what you notice is that individuals from minority populations were included in the expansion approval. This is very exciting. Well, we can also learn from children who were started on ivacaftor, Kalydeco, since that has been approved for infants as young as 4 months. We believe that if we can start a modulator early in a child's life, that they will have better outcomes because we could prevent many of the complications of this disease. Early in life of someone with CF, nutritional parameters are arguably the most important since adequate growth can impact so many outcomes. We always thought that the pancreas was damaged at birth. However, we may have to rethink this idea. In the study that's presented here with ivacaftor, we notice that there have been improvements in fecal elastase. And fecal elastase is used to measure pancreatic function. The long-term implications of this data aren't known, but they clearly show that we need to change our ideas about what we think, that perhaps there is some recoverability of pancreatic function in individuals with CF. Over the next several years, we will be learning a tremendous amount about the impact of Trikafta. Listed here are a number of the studies that are enrolling or are planned to be enrolled, and they will inform us of the effect of Trikafta. When they are all fully enrolled, we expect that nearly 8,000 participants will be in these studies. And if you are asked to be part of these studies, I hope that you will consider. The PROMISE study is a study to assess the long-term impact of Trikafta on various clinical parameters, including pulmonary or lung outcomes, GI complications, inflammation, infection, and sinus disease. The PROMISE study is fully enrolled and includes 3 separate groups. Those individuals who never had a modulator before starting Trikafta, represented in the blue. Those individuals who were on a 2-drug modulator, Symdeko or Orkambi, before starting Trikafta, that would be in the orange. And those individuals who were on ivacaftor, Kalydeco, before starting Trikafta, in the red. What's important is that you can see that in each group, they had an improvement in their lung function. Of course, the one that had the greatest improvement were those individuals who never had a modulator, but you can see that there is improvement in all of them. And the individuals who had a modulator before already had some improvement in their lung function previously when they were on the modulator therapy before Trikafta. So some might be asking, when will Trikafta be available to those individuals who are much younger? Well, we can learn by looking back again at our past. It took about 8 years from the initial approval of ivacaftor, Kalydeco, to the approval of individuals younger than 1 year of age. Orkambi was first approved in 2015, and studies are presently ongoing for those individuals ages 1 to 2. And of course, we know that ivacaftor was approved at the end of 2019, approval for individuals ages 6 to 11 this past year. And if everything goes smoothly, we expect that individuals with CF can be studied for as young as 2 to 5 years of age. And then the next steps, of course, would be studying those individuals younger than 2 years old. I want you to know that the CF Foundation is not only working with Vertex on studying modulator therapies. we are also working with other companies. Well, what about nonsense mutations? The CF Foundation is committed to finding and funding pharmacological therapies to meet the needs of those with nonsense mutations. We have actively funded various programs listed here to try and help us meet this challenge. Elox Pharmaceuticals has the most advanced program, and it currently is testing a medication. We don't know yet how effective it is, but we do know that it has been found to be safe. And our labs at the CF Foundation, at the individuals at the CF Foundation labs continue to work with these various organizations. So let's look back again and talk about the path to the cure. We discussed the repair of the CFTR protein through modulator therapies. But what if CFTR were a car? Well, that would mean that everyone with CF had something with their car that didn't function. And there are many reasons why a car doesn't function, just as there are many gene mutations that cause CF. So, if we tried different genetic therapies for CF, what if we tried messenger RNA therapy? Messenger RNA has been in the news quite a lot in 2020 because of the COVID vaccines. We know that messenger RNA therapy could be safe and effective, but it would be similar to having a rental car. It would have to be repeated over and over. It could transport you there, but it would have to be like a rental car. You'd have to use it again and again. Well, what about gene therapy, represented by the red squiggle line? If we use gene therapy, that would mean that everyone with CF would need a new car. Well, what about gene editing? Gene editing would be like bringing the car to an auto body repair shop. They'd have to figure out what's wrong with the car. And then they would have to modify or repair that gene. It might be a small piece, it might be a larger piece. The CF Foundation Lab believes that this is the most promising path to the cure. If you want to learn more about this in more depth, you can watch Plenary 2, and I'll tell you at the end of my presentation how you can find that. So the path to the cure, I hope you've heard tonight that we're looking at multiple different ways to find our way down that path to a cure. We have many industry partners, and we continue to fight together. We're not just looking in one place. We're not just looking at one way. So I hope that you've heard tonight that by looking at our past, we can understand our present, we can peer into the beautiful horizon, and we can celebrate many successes that we've had together. We will continue to look forward as a community. The clinical trials and genetic therapies which are coming will no doubt create new and perhaps some unexpected challenges. But we are confident that given the combined talents of our community, we will reach that bright horizon of cure found. If you want to learn more about anything that I said tonight, I took 3 plenary sessions, so 3 hours of information, and tried to pare it down to about 20-25 minutes. You can go to the CF Foundation Facebook page and go to CF Watch, and you can watch Plenary 1, 2, or 3. We also will be moving all of the recorded sessions from the CF Foundation, the North American Conference, to our Cystic Fibrosis Foundation YouTube channel, and that will be done by January of 2022. You also might want to learn more about genetic therapies, and that will be presented in a webinar on December 14th. And you can register for that webinar. Your team will get that information in their inboxes tomorrow morning so they can share that link out to you. So I'm not sure if there are any questions. If you are watching the recording of this and you have a question, please feel free to email me at plomas@cff.org, and I will do my very best to help you.
Thank you, Paula, for your informative presentation. And thank you so much, everyone, for joining us this evening. We look forward to our next 2022 Cystic Fibrosis Education Night.